If you are an Indian medical graduate, then this video is for you. So Indian medical graduates have lots of myths about foreign medical graduates, which are FMGs. I am myself is foreign medical graduate and I know how foreign medical graduates being treated in India. So some of Indian medical graduates have myths about FMGs that we cannot treat patient, we don't know anything, we don't have any knowledge, we cannot pass neetpg, we are not as good as IMG doctor, and lots of myths and lots of discrimination about us. So I wanna give disclaimer first that this video is not about hate. This video is about treating doctors right, whether he or she is IMG or FMG. So I'm just giving my opinion. If you think that this is wrong, then you can let me know in the comment section. So let me give you my introduction first. That my name is Akash Mangukiya and I'm 4th year medical student doing my clinical rotation at Kathmandu Medical College and Teaching Hospital. Right now I am in my radiology posting. You can see that video in the description box below. I have put link in the description box below, and I'm about to complete my MBBS. So if you are new here, then hit the subscribe button below because I'm gonna tell you the truth about FMGs. And if you like this video, then consider hitting the like button because I'm gonna tell you the truth about FMGs in this video and lots of people need to hear this. So without any further ado, let's get started. So I think that first disbelief that we go through as a FMG is that we don't have enough knowledge. I want to ask you guys a question. Why you think that? We study as much as people studying in India. I know the exams are different than in India and in foreign countries, but we are studying the same course. We have just different method to study. You guys write written exam, but it doesn't mean that we know less because we are writing MCQ exam. Remember the toughest medical exam, USMLE, which is also MCQ based. So I want to tell you guys that please don't judge us on our medical knowledge. We know as much as you guys know, and for that we are giving FMG exam to prove ourselves that we are as good as you guys. Human anatomy, physiology and pathology is everywhere same. Outside of the India, patients are not alien. We are learning from same human body. I believe that outside of the India, they have different most common diseases than India. But we also learn those most common diseases in our FMG exams so that we get oriented to the Indian diseases. So the second disbelief is that we don't have enough clinical exposure. So I believe that this is the biggest disbelief so far. So people are just brainwashed that FMGs don't have enough clinical exposures. Like, how can you guys say that? We also go to hospitals, we also go to OPDs, we also go to wards, we also go to operation theaters. We get posted in every single department from medicine to anesthesia department. And if you have seen my previous video that I am in my radiology department and I'm getting so much clinical exposures. Like, people just believe what they hear from others. And that's why we are getting so much discrimination on this. And most people believe that we don't know anything because we haven't got admission in India from NEET UG. So they just think that we are not capable of anything because we didn't get admission. Most people think that we are dumb, we have no skills. So let me tell you to the people who thinks that we don't have any clinical exposures, that I have done so many procedures, like I have given spinal anesthesias, done intubations, I have put so many urinary catheters, have put NGs, and also I have assisted in the surgeries like laparoscopic cholecystectomy, I have assisted the cesarean section, I have done the normal delivery, and I have done the suturing of the episiotomy, I have done the suturing of the cesarean section, I have done the suturing of the laparoscopic cholecystectomies, and done so many dressings and taken out so much earwax from ear canal. I have done the casting of the fractures too. I can make whole list of procedures that I have done. So right now I just wanna say you to the people who thinks that we don't have any clinical exposure, that I have done this many procedures, and this many procedures barely have done any medical students in India. So the third disbelief is that after we graduate and after we pass FMG exam, they don't consider us as good as doctor who have passed from India. Some of the IMG doctor thinks that FMGs are not good and efficient doctor because they think that we have less clinical exposure. But as I said you guys, that some of us have excellent clinical exposures like me. They treat us like we don't know anything, we are poor at knowledge. We are even proving ourselves by giving the FMG exam that we are as efficient as them. And you can say this is just your disbelief, or you can say myth. And I personally think that next exam decision is a good decision, because we will not get discriminated by anyone. Every student will be the same. All have to give next exam, whether he or she is FMG or IMG. There won't be any partiality. And I have to tell you guys that some FMG also secure good rank in neetpg exam. So at last I'm requesting you that don't see us any different. Doctors are doctors. We are here to treat patients, whether you study from India or study outside from India. So that was all I wanted to say, and I made this video because some of us have to speak up. This video is not for any discrimination or any sort of hate for IMGs. I respect them as I respect all the doctors. So doctors are the ones who are in front line of this situation. They are not seeing their families and they are not seeing their discomfort. They all treat the patient same, whether he or she was IMG or FMG. And India is already short of doctors, so let's unite and save the world from this situation. And let's not do any discrimination and any sort of hate towards each other. So if you agree with me, then hit the like button and make this video reach to as much as people possible, and comment down below if you think the same and if you faced any discrimination or hate. And don't forget to hit the subscribe button. Let's make this family 500 subscribers. I will see you guys in the next video. Until then, stay safe. Bye bye.